And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So we've got lots of medical questions. We're going to jump right on in. What's the best treatment for a sinus infection that has your whole face swollen, eyes black with a black eye, and your head hurting?
Well, a lot of times if it's that severe, probably prescription medications will be necessary. So probably need to get to the doctor for some antibiotics or some steroid nasal sprays or even some prednisone. I use a lot of prednisone in the office. I know some physicians are a little leery about that. It does have side effects, but it's very effective.
Okay. Is the stomach flu airborne contagious?
A lot of times it is not airborne. It's probably something that you've eaten or contact, as we say. A lot of times if your kid is sick or your husband's sick, probably you will get it as well. Normally the upper respiratory infections like the flu, a lot of times it's airborne or pneumonia because people are coughing and they have what we call respiratory droplets in the air that you inhale. So a lot of times the lung problems are respiratory droplets.
Okay. What do I do about hot flashes?
A lot of times hot flashes we think is related to menopause. A lot of times we can use prescription medication, hormone replacement therapy. We've gotten away from prescribing hormone replacement therapy for ladies because it does appear to increase some side effects, including cancer, blood clots, medication side effects. So hormone replacement therapy can be prescribed just after conversation with the patient about those potential risks. Some over-the-counter medications such as black cohosh work very well. Those are called phytoestrogens, which work very similarly to hormone replacement therapy. When you ingest them, it's not prescription. There's a medication called Catapress or clonidine, which is a blood pressure medicine, as well as Effexor, which is an antidepressant, works very well. So a lot of different choices.
Is there anything naturally that someone could take?
Well, the black cohosh, I guess, would fall under that category in terms of natural. It's not synthetic or etc. It's not pharmaceutical. It's not prescription. But beware, you know, natural doesn't necessarily mean safe. It can be just as detrimental to your health. So certainly beware that those medicines can cause problems. If you have any problems, certainly stop the medicine, get with your doctor. And
then, of course, if you take any of those natural things and then you add prescription medication on top of those, you need to talk with your physician.
Polypharmacy is what we call that. That should always be a focus of your doctor visit if you're on one or two medications, is to go over why you're on the medicines, what the medicines are for, and if you can stop them.
Okay, another question. What's the best way to treat a cough with discharge? Sometimes the cough is quite severe.
Yeah, a lot of times cough, a symptom of upper respiratory infections, sinusitis, rhinitis, COPD, allergies, asthma. So it just kind of depends on the root cause. Again, steroids work very well. Decongestants, be careful if you have other medical problems such as heart disease. Sometimes we use inhalers, especially if you have chronic lung disease such as asthma, COPD, work very well.
Now you mentioned steroids having a detrimental effect. What would that be?
A lot of times if you have diabetes, it can make your sugar go up. It can cause palpitations. It can cause insomnia. It can cause you to want to eat burgers and fries every day. So
what's wrong with that?
Well, if it's 2 or 3 a night, it can cause weight gain. So it's very powerful. It's been around for years. It's cheap, but you just have to be aware of the side effects and you know, have a consultation with your physician if the side effects are too severe.
All right. We've got lots of other questions. We'll get to those in just a minute. So don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. A 62-year-old woman says the center of her chest hurts sometimes when she's moving around. She had a stress test. It came back normal. What else could it be?
I think that's good. We're always concerned about heart disease, as it is one of the more common symptoms of chest pain, heart disease. It is a big killer in America. Probably musculoskeletal is a cause of her symptoms, primarily because when she moves her chest, that's when it hurts. That's typical for musculoskeletal disease. There's also a condition called costochondritis, which is basically inflammation, arthritis of the chest bone. Typically can be treated with anti-inflammatory medications.
Nothing to be worried about?
Not at this point. I would try the anti-inflammatory medications first. Sometimes you need prescription anti-inflammatory medicines, so certainly if it doesn't get better, get with your physician.
Okay. Is there a certain amount of water to drink to avoid a bladder infection?
Not really. I mean, I know we've heard about the 8 gallons or the 8 glasses of water a day. I don't think that's absolutely necessary. Your body basically tells you when it's thirsty. That's when you need to drink. So I don't think there's a certain amount. Certainly patients having problems consuming too many high-calorie drinks, so try to substitute those high-calorie drinks with water as much as possible.
A woman had her spleen removed. What immunizations should she get since her immune system isn't as strong anymore?
All the typical ones, flu shot, in particular the pneumonia vaccine, which protects us against certain bacterial infections, which they're at high risk for. Viral hepatitis immunization, just all the basic immunizations that most Americans need. A lot of times they will give that to you prior to your surgery, and certainly if you think you're sick, get in to see the doctor or the emergency department because you are so vulnerable to infections.
Is there anything she should avoid?
Not necessarily, just again, healthy lifestyle. You know, we can't live in a bubble. Just understand that she is susceptible to infections, and don't let anything go for several days before she gets evaluated, because you want to get on top of these illnesses as fast as possible.
A 62-year-old male has 6 to 8 horizontal ridges across his thumbnails. What could that be?
A lot of times certain medical problems can cause abnormalities in the nail, thyroid disease, kidney disease, heart failure, diabetes, because it impairs the circulation in the nail bed. A lot of times we already know what the disease is. Very seldom do we make a diagnosis just based on the nail. Another condition I remembered is psoriasis, can sometimes cause changes in the nail bed. So a lot of times it's a symptom of the disease that we're treating.
A 2-year-old boy eats healthy but has constipation. What could it be and what can be done?
A lot of times they need a supplement to help with their bowel movements. Miralax is a good product over the counter. There's also some other prescription medications such as Amitiza, which works really well. Certainly if he is eating a good diet, which should include some fiber, and they're still having constipation, certainly get to the pediatrician to make sure there's nothing congenital, there's nothing wrong with the digestive system, that there's no problem. Certainly if he's on medications, that's always a concern as well.
Okay. Is it safe or unsafe to leave a splinter in a child's foot? Will it work its way out, or is there a remedy to removing it safely?
Typically it's okay, but certainly it's a foreign body, and the foot actually is very good at protecting itself against foreign body. It should wiggle its way out. Certainly if it's painful, has drainage, it's red, it's swollen, that means infection. Try to get the foreign body out, but I think if you ignore it a day or two and it comes out on its own, shouldn't be a problem. Basically based on symptoms. If it's painful, try to get it out.
Okay. Is there a vitamin or something over the counter to help boost energy and stabilize mood swings? I've heard fish oil was good. Any truth to that?
Not really. I think for most patients, try to get your vitamins and minerals in the food that we eat, vegetables, fruit, whole grains. What I know about health and illness is if you're eating healthy, your energy typically will come back. Unfortunately, most Americans are not doing that. We're consuming a lot of high-calorie dense food, a lot of processed food, which absolutely has no nutrients in it whatsoever.
A lot of sugar.
A lot of sugar, a lot of fat, a lot of salt. It drags us down, it drags our energy down. So a lot of times if you can just improve your diet, that will give you the energy that you need, not necessarily just grabbing a couple of vitamins.
All right, Dr. Levine, as always, we appreciate you taking
Yes,
the time
ma'am.
to stop by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com, or you can post those questions every Monday on our KFTM News Facebook page. Coming up next on Live at 5, Greg joins us with a look at your forecast.